Welcome, medical students, to today's lecture on the fascinating topic of gastrointestinal embryology and malrotation. In this comprehensive session, we will delve into the intricate details of the embryological development of the gastrointestinal tract and the complex mechanisms involved in the rotational and fixation processes of the intestines. Additionally, we will explore the different types of malrotation, anatomical variations, pathophysiology, clinical features, diagnostic imaging modalities, surgical interventions, potential complications, long-term outcomes, and association with other congenital anomalies. So let's begin our exploration by delving into the embryological development of the gastrointestinal tract. One potential complication that can arise during this process is malrotation. Malrotation refers to abnormal rotation and fixation of the gastrointestinal organs, which can disrupt their normal anatomical relationships and lead to potential complications such as volvulus. Overall, understanding the embryological development of the gastrointestinal tract is crucial for medical students to recognize and manage conditions such as malrotation, ensuring the well-being of their future patients. During fetal development, the intestines undergo two rotations to ensure proper placement within the abdomen. The primary rotation involves a 270-degree counterclockwise rotation, while the secondary rotation refines the position of the intestines. The end result is the characteristic shape of the gastrointestinal tract. Malrotation can occur in three forms: non-rotation, incomplete rotation, and reversed rotation. Non-rotation involves a lack of the normal counterclockwise rotation, incomplete rotation involves partial rotation, and reversed rotation involves the intestines rotating in the opposite direction. Structural variations typically accompany malrotation, further contributing to the complexity of the condition. One such variation is the presence of Ladd's bands. Ladd's bands are fibrous bands originating from the right side of the duodenum and extending to the right abdominal wall. These bands can cross over the duodenum, causing compression and subsequent intestinal obstruction. Furthermore, malrotation can predispose individuals to the development of midget volvulus. This life-threatening complication occurs when the small intestine twists around the mesentery, resulting in compromised blood supply and potential ischemia. Timely intervention is essential to relieve the volvulus, restore blood flow, and prevent further complications. Malrotation causes intestinal obstruction due to abnormal positioning and fixation of the intestines. This leads to twisted intestines and closed-loop obstructions, hindering the flow of contents. The abnormal arrangement may also compromise blood supply, resulting in ischemia or necrosis. The clinical features and symptoms associated with malrotation can vary in presentation and severity. Common manifestations include abdominal pain, which can range from intermittent, colicky pain to severe, constant pain. Moreover, individuals with malrotation often experience vomiting, which may be bilious, indicating the presence of intestinal obstruction. The inability to pass stool or gas is another significant symptom indicative of mechanical obstruction. In some cases, malrotation may lead to volvulus, causing sudden and severe symptoms such as abdominal distension, tenderness, and signs of peritonitis. Emergent medical attention is crucial in these situations to prevent potential complications. Accurate diagnosis of malrotation is crucial for effective management. Imaging techniques, including the upper GI series, abdominal ultrasound, and CT scans, help identify abnormal alignment, obstruction, and other complications related to malrotation. These non-invasive procedures provide valuable information for treatment decisions. Ladd's procedure is the main surgical intervention for malrotation. It involves detorsion of the intestines, division of Ladd's bands, widening the mesenteric base, and repositioning the small intestine. Emergency surgery is required for volvulus to prevent complications and restore blood flow. Malrotation can cause intestinal ischemia and short bowel syndrome. The compromised blood supply can lead to tissue damage, necrosis, perforation, or peritonitis. Severe cases may require nutritional support, specialized diets, or even intestinal transplantation. Patients with malrotation should receive long-term follow-up care to address potential complications. Nutritional deficiencies, growth and development challenges, and gastrointestinal complications should be monitored and managed through dietary management, nutritional supplements, regular imaging studies, and evaluation of gastrointestinal function. Malrotation has been found to be associated with other congenital anomalies, further highlighting the complex nature of this condition. Congenital heart defects, chromosomal abnormalities, and gastrointestinal malformations have all been reported in conjunction with malrotation. The exact underlying mechanisms for these associations remain unclear, but it is theorized that disturbances in the development of early embryonic structures may contribute to the occurrence of multiple congenital anomalies. Therefore, when evaluating a patient with malrotation, it is essential to perform a thorough assessment for other associated anomalies. Appropriate screening and diagnostic investigations should be considered to identify any potential coexisting conditions and provide comprehensive patient care. Malrotation development is influenced by genetic and environmental factors. Familial clustering and a potential genetic predisposition have been observed, although the exact genetic basis is unknown due to complex interactions between genes and the environment. Other risk factors include maternal age, prenatal exposures, and unidentified factors. Understanding these factors can help identify high-risk individuals and potentially intervene earlier. In summary, studying gastrointestinal embryology and malrotation helps us understand how the gastrointestinal tract forms and develops. This knowledge allows us to provide better care to patients with malrotation and improve outcomes. Thank you for watching, and see you next time.